All right. Hello, hello. Welcome, everyone. I guess we can go ahead and start. It's 11:05 here on the West Coast. My name is Annie Obadan Udo. I am from UCSF, University of California, San Francisco. I'd like to welcome you all to the third National Graduation Celebration of Dental Public Health Residents. This ceremony is being hosted by the American Institute of Dental Public Health. Today we have put together a nice agenda for you, and we hope that you enjoy meeting all the residents who have worked tirelessly throughout the years to get to this point. To begin our session, I would like to call on the president of the American Board of Dental Public Health, Dr. Scott Tomer, to give a few opening remarks.
Welcome, everybody. I'm Scott Tomar. As I said, I'm the president of the American Board of Dental Public Health. I'm on faculty at UIC College of Dentistry, and I just wanted to first congratulate everybody on finishing your residency. I know what how much time and effort it takes to do that. So congratulations on getting to this point, and certainly would encourage all of you to keep the momentum going by challenging the board examination offered by the American Board of Dental Public Health and become a diplomate. Just wanted to say thank you, and it's a pleasure to be here.
Thank you, Dr. Tomer. I definitely second that. Please put everything you need to put together to challenge the board exams and become diplomates. All right, with that, we'll move on to our next speaker to give her opening remarks. I'd like to invite Dr. Nadia Laniado, who's the president of DPH, the American Association of Public Health Dentistry.
Good afternoon, dental public health residency graduates and faculty. On behalf of the American Association of Public Health Dentistry, I'd like to congratulate all of you for this extraordinary accomplishment. You've all worked very hard to get where you are. As future dental public health professionals, you now have a responsibility to put your education to work, not only in service to your own aspirations, but fundamentally towards advancing an equitable oral health care system where every person is entitled to good oral health regardless of age, sex, race, immigration, or income status. What you choose to do next and what shape this takes for each of you depends on many factors and may evolve as you yourself mature and grow. Certain qualities, however, will keep you grounded. Maintain excellence in all you do and be patient. Change does not happen overnight. Making mistakes and taking some risks are part of what will make you successful. So don't get discouraged, keep at it, be passionate, and be persistent. It will pay off. Always remember that the AAPHD is your professional home base for your career. Please maintain membership within our organization and get involved. You will find that you will make lifelong friends and colleagues who will support and nurture your career as you continue on your dental public health journey throughout your life. The AAPHD believes in you and wishes you all long, happy, and successful careers in dental public health. We are here for you and can't wait to see what you do next. Thank you so much and congratulations.
Thank you very much, Dr. Naniado. Moving on, I'd like to invite Dr. Dave Capelli, who's the chair of the American Institute of Dental Public Health.
Thank you very much, Annie, and appreciate this opportunity on behalf of the American Institute of Dental Public Health to welcome you today, to welcome everyone, and to congratulate our recent dental public health graduates. What a major accomplishment. You should be very proud of your accomplishment. It was a difficult one, as was already mentioned, and you put in a lot of hard work to come to this place. The American Institute of Dental Public Health, or AIDPH, is very proud to co-host this ceremony with our partners in AAPHD and the American Board of Dental Public Health on this, our third anniversary, or our third annual ceremony. So this ceremony recognizes your milestone achievement, and we're thrilled to be a part of it. You've chosen a distinguished specialty. Dental public health is often referred to as the conscience of dentistry. And so and because of that, the practitioners of dental public health, we care about the community and are a voice for the underserved. We seek to reduce health inequities and barriers to achieving dental care. I challenge you to continue to look for opportunities to improve the oral health of the communities that you serve and to address health disparities wherever you see them. There is much work to be done, and each of you will have a part of improving oral health, and I look forward to seeing what you accomplish in the future. While your educational journey may be coming to a close, I encourage each of you to further distinguish yourselves by becoming board certified in the specialty of dental public health. As Dr. Tomar mentioned, this achievement places you among a very select few of 200 dentists in the nation. I hope you will consider challenging this examination, and I look forward to welcoming you as diplomates of the American Board of Dental Public Health in the future. It is our pleasure to sponsor this event with the partner organizations and to honor each of you and to recognize your accomplishments. On behalf of AIDPH, I want to extend best wishes for your continued success in dental public health. Thank you.
Thank you for those wonderful words, Dr. Capelli, and thank you for sponsoring this event. This year, we're introducing a new speaker. I would like to invite Dr. Megan Cloyd, who is a diplomate of the American Board of Dental Public Health and also a recent graduate. I'd like her to give a few words on behalf of the residents.
Thank you so much for the introduction, and hello everyone, and a big congratulations to this year's class of DPH graduates. I am truly honored to be able to share a few words of support and encouragement with all of you as a recent graduate myself. Reflecting back on my first year as a dental public health specialist, I realized that dental public health is really the opposite of most dental specialties when it comes to scope. I like to call DPH the anti-specialty, which has yet to be trademarked, but just think about it. Every other specialty of dentistry narrows in scope as training progresses. Pediatric dentists focus on the treatment of children, endodontists focus on root canals, etc. Dental public health specialists treat entire populations and address the complex factors that drive health in an ever-changing world. We are a specialty that is zoomed out rather than zoomed in. In fact, we don't just focus on oral health, but overall health as public health professionals. Members of our profession advocate for things like gun law reform, abortion access, Medicaid expansion, addressing food insecurity, and prison reform, just to name a few. We see the big picture. I believe that we, together, can make an enormous impact on the lives of others and truly change the world for the better, but it's not easy work. This is why I think it's critical to hold on to your why. As you enter the workforce as newly trained dental public health specialists, you will face many challenges. Some will test you to the very limits, but always go back to your why. In a commencement speech a few years ago at Howard University, the late Chadwick Boseman said, "Purpose is an essential element of you. It is the reason you are on the planet at this particular time in history. Your very existence is wrapped up in the things you are here to fulfill. The struggles along the way are only meant to shape you for your purpose. If you ever need a little inspiration, please reach out to any one of the amazing members of our specialty. I have been so pleasantly surprised at how welcoming and kind everyone has been. Get involved, connect, go to meetings, join organizations, and meet people. Our profession absolutely needs bright, ambitious people like you to keep doing the good work. You are all going to make this world a little bit brighter. So congratulations, and I am pleased to be able to call you all my new colleagues. Thank you.
Thank you very much, Dr. Clyde. And really, I would encourage everyone to hold on to those words. Always remember your why, hold on to your why, and utilize your networks. We're all here for you, and we're rooting for you, and we want you to succeed. So please feel free to reach out to any one of us if you ever run into a roadblock or if you just need an introduction. And that's why we're spotlighting all of you today, so that everybody can be aware about who the new graduates are. With that, we'll turn to a recorded message from Rear Admiral Tim Wicks, the Assistant Surgeon General and Chief Dental Officer of the United States. Thank you.
Hello, thank you to the American Institute of Dental Public Health for the invitation to speak to all of you today. And thanks to them for once again holding this now annual event, recognizing all the nation's DPH graduates. This is my third year speaking at this event, and I'd like to join all my colleagues to congratulate each and every one of you for a monumental achievement in graduating from your dental public health residency. As a dental public health residency graduate and diplomate of the American Board of Dental Public Health myself, I highly value and respect your commitment to dental public health. Over the last 2.5 years, public health has been at the forefront of the pandemic, as you know. And if anything good has come out of the pandemic, we've seen a renewed emphasis on oral health integration with overall health. This makes sense, of course, as you cannot separate the mouth from the rest of the body. For decades, we've known about the links between oral diseases and systemic diseases like cardiovascular disease, lung disease, cognitive issues, pregnancy issues, and other inflammatory processes. With the pandemic, we have played, as oral health professionals, a very important role doing testing, vaccinations, and so forth. But there's a bigger role that we can play moving forward in screening and doing point of care testing for chronic diseases like depression, hypertension, diabetes, high cholesterol, and more. And so I challenge you to think first as healthcare professionals, and then secondly as oral health professionals. We know there are 28.2 million Americans that see a dental provider each year and not a medical provider. So there's a tremendous opportunity for us to get involved in screening for chronic diseases and educating our patients about them. Another thing is that we have to collectively break or continue to break down the silos, not just between oral health and medicine, but within oral health itself. We cannot continue to fight among ourselves about the best way to provide services to vulnerable populations like older adults or adults living in poverty, and we have to work together. Of course, breaking down silos between dentistry and medicine starts with interprofessional education and interprofessional collaborations. You can't expect our medical counterparts to just quickly jump in on oral health integration as they face some of the workforce strains that we do in dentistry. Breaking down silos and embracing the medical dental integration starts and ends with relationships at the local community level. And each of you has a role in building those collaborations throughout the healthcare system. As oral health professionals, you'll be in high demand as you look upstream to plan and manage complex oral health programs, evaluate and recommend improvements to dental delivery systems, conducting surveillance, conducting research, and so forth, and serving as an advocate for oral health and public health in the future. But we know that the field of dental public health is not an easy road. You'll face a lot of challenges along the way. First and foremost, we know that access to affordable, culturally competent, and geographically available quality oral health care is still a challenge throughout our country. And your leadership is going to be critical at the local, community, state, and national level in the future to help ensure that the public health voice will continue to be heard. There are many, many ways to address the access to health care problems in this country. That's why we need each of you to objectively look at all these different alternative workforce models, such as dental therapists, expanded function dental assistants, community dental health workers, or coordinators, community health workers, independent and collaborative practice dental hygienists, as all of these may be possible solutions to access problems. With the release of that first Surgeon General's report on oral health in 2000, we made a statement that oral health means much more than healthy teeth, and that it's integral to the overall health and well-being of all Americans. That still holds true today, and in fact, you can't have overall health without first having oral health. And as we welcome all of you into the dental public health world, we know that each of you, through your respective dental public health residencies, have been given the knowledge, skills, and abilities to emerge as leaders within communities, within organized dentistry, and within the profession itself. So once again, congratulations to all of you upon your graduation from a dental public health residency program in the country. I wish you much success in the future. Thanks for all the residency directors and faculty who've played a major role in shaping all of you, and good luck to you in the future. Thank you.
All right. Thank you very much, Dr. Ricks. And please take those words to heart. Now we will transition into the recognition portion of the ceremony. I would call on each program director to introduce the residents who are graduating in the class of 2022. Once I call on your name, please turn on your video and introduce your camera. At the end of the introduction, I would ask that all the residents turn on their cameras and you can say a few words, just 1 minute max, and we can take a screenshot of the residents and the residency director. All right, with that, I would introduce Dr. Mary Tavares from Boston University.
Thank you. Thank you very much. I really want to thank AIDPH and Dr. Eni Obadan-Udo for the hard work and keeping this going, because as Dr. Coit said, we're a small community. We're all connected. So I think this is a great opportunity. You've met each other, some of you, but it's another great opportunity to celebrate together and to see each other. So with that, I'd like to introduce 6 new members of our dental specialties. Not everyone could be here, but I'd like to start with Dr. Helen Wen, who is somewhere in the Boston area looking at kids' teeth in a school-based program at this hour. And she couldn't get away because I don't see her on here, but she's been an excellent resident and will be looking forward to what she's going to do in our profession in the years to come. And Dr. Abdullah Bakari, who I see is on here. I'm pleased to say he completed his residency in flying colors and will be moving on to his home school in Saudi Arabia. Can you say a word if you like?
Hello, everyone. I'm Abdullah Bukhari from King Abdulaziz University, Saudi Arabia. I finished my residency program from Boston University. I'm going back to Saudi Arabia in a few weeks from now. I will be teaching in the Dental Public Health Department at King Abdulaziz University. Thank you all for organizing this event, and thank you for all the faculties who helped me to get educated. Thank you.
Thank you. And Dr. Inder Singh, who I don't think is making it on here. He's going to be here a little while, but that's not good enough. But also just finishing up with us, and we agree that our faculty is amazing and caring, and I have to say he is too, and I think we'll be hearing from him in his future, but we'll also see him soon, but not in time for this. Thank you. And Dr. Harsimran Pawar, who the airlines have deemed that he should be stuck somewhere. Are you on, Harsimran, on the phone? I don't think so. But again, we wish you the best of luck in your future as you head off to Michigan or wherever you are in the air today. And Dr. Deepthi Maya. And Deepthi, you are on here, so if you'd like to say a word or two. You have to put on your, you're muted, huh?
Thank you so much for introducing me, Dr. Tavares. Good afternoon, everyone. It's been a pleasure to pursue DPH at Boston University School of Dental Medicine. And I really owe this to all our faculty, and especially Dr. Tavares, Dr. K, Professor Scott, and Dr. Single, and my supportive family, without whom I wouldn't have been here. And I look forward to more to spread my wings further in the school, in the field of public health. And thank you so much.
Thank you. And Dr. Fahim Mihir.
Hi, good afternoon, everyone. First of all, thank you so much for doing this virtual graduation ceremony. And I'm sorry, and I'll be graduating from my program in August. And I'd like to thank all my faculty members for their continued support. And last but not the least, my family, my wife, for her continued support as well. And without all of you, this wouldn't have been possible. So thank you so much. It's a pleasure to be here to attend this event virtually. Thank you.
Thank you.
All right, and then now for the screenshot, if you can turn on your videos, and then we can have a screenshot of your program. Turn on, yeah.
Fahim.
All right. Okay. Do we have it?
Okay. Thank you.
All right. Thank you, everyone. And with that, we'll move on to the CDC program, Centers for Disease Control and Prevention. I'd like to introduce Dr. Gina Thornton Evans.
Good afternoon, everyone. I would like to thank the American Institute of Dental Public Health for putting this together, especially for Dr. David Capelli, as well as Dr. Annalise Condren as well. And I would like to introduce Dr. Ekba Ioma, who is graduating very soon from our program. Really very excited about her next steps, and just wanted to share with everyone that even in the undergraduate training that she started, she actually focused on public health. So, and has met a number of people that we're very familiar with, including Dr. Deshanga Kleiman, as well as Mary Otto early on in her career. Dr. Ioma, would you like to say a few words? You're going to unmute?
It doesn't matter how many times we've done this, muting is still a special skill. Thank you so much. Good afternoon, everyone. Thank you so much, Dr. Thornton Evans, for this year in which you've guided me into dental public health. My background has thankfully always been public health, but as I've grown in the field, it's become more specific to oral health. And I really hope that I get to keep learning from all the grades that come behind me. And I look forward to just contributing to access, care, utilization within oral health. Thank you so much for guiding me and showing me all that I need to know. I know there's still so much to learn, but I think this is a great first start, and I'm around great company.
Right. Well, thank you. Thank you, Gina, and thank you, Ekba. Moving on, I'd like to acknowledge the Eastman Institute of Oral Health from the University of Rochester. Dr. Sangeeta couldn't be here, and I'll just like to acknowledge the program. And with that, I'll move on to the Harvard School of Dental Medicine. The program director is Dr. Hind Al-Qaderi.
Good afternoon, everyone. Like everyone else, I would like to thank the American Institute of Dental Public Health for arranging this event and bringing the dental public health community together. And actually, I was looking at our Harvard graduate, and I didn't see anyone, unfortunately. I know that they are preparing to go back to their country. They just graduated, they're packing, and they have limited time to spend it here because of their visa. So I apologize for that. I can't see anyone here. But I would like to first congratulate all of the dental public health residents who are here today and for graduating. So I'll recognize our resident here. So we have Dr. Noura Al-Amer. She's the diplomate and she finished her dental public health certificate program, and also she did her doctoral degree in oral biology at Harvard. And then we have Dr. Abir Abdullah. She's also from Saudi Arabia, and she also finished her doctoral degree in oral biology and the certificate also in dental public health. And then we have Dania Bahdila, also from Saudi Arabia, and same thing. She finished her doctoral degree in oral biology with a certificate in dental public health. And I would like also to recognize Dr. Mary Tavares, because I've been telling this to everyone that she maybe spent more time with these residents more than I did. And I just joined the program this year. So thank you, Mary. Yeah, and I would like to again congratulate everyone here, and thank you.
All right, thank you, Dr. Al-Qadari. Thank you, Dr. Tavares, and congrats to all the residents. With that, we'll move on to the North Carolina Department of Health and Human Services. The program director is Dr. Rhonda Stevens, who could not be here today. And so I'll introduce the residents who are graduating from her program. The first we have is Dr. Ruma Simhan, and she says here she'd like to thank Dr. Rhonda Stevens, Dr. Jane Weintraub, Dr. Mark Moss, and the Residency Advisory Committee and the employees in the oral health section. Their continued support and guidance and advice throughout the program helped her learn so much about the specialty. All right, next resident. Dr. May Salama. She would like to thank her residency director, her research mentors for all the support and mentorship they have shown her over the past year. She can honestly say that she would not be even close to where she is today without the encouragement, advice, and support that they have given to her. All right, thank you. Next slide. All right, the next program is Temple University, and the program director is Dr. Marisol Tellis Merchant.
Good afternoon, everyone. First of all, thank you to the American Institute, Dr. Capelli, Annie, and Elise for putting together this nice event. I think it's very important to celebrate the class of 2022, so thank you for that. We currently have 3 residents, but only 1 is connected. So I want to go ahead and recognize Dr. Ambika Reddy, who was wonderful, will be finishing the program at the end of August, has been very active in research, and I wish you the best. Dr. Reddy, you want to share anything with the group?
Good afternoon, everyone. This is Ambika. So I'm graduating this year from Temple University, Convoke School of Dental Medicine from Philadelphia. And thank you for hosting this event for all the DPH residents. And I'm so glad that I chose this program at this point of my life. And I'm really proud that I'm a DPH resident and looking forward to challenge the boards next year. And I really thank Dr. Tellis for guiding me all the year that we have passed and discussions and everything. And I thank my family and friends and seniors. Thank you.
Thank you, Ambika. And thank you all.
All right, so we can have a screenshot of you and Ambika. Okay, now moving on to the next program, we have the Texas A&M University. The program director is Dr. Peggy Timothy, who could not be here today due to a clash, I think, conflict in her schedule. So I'll introduce her resident. Dr. Samula Sheikh. He'd like to thank Dr. Amal Nuruddin, Dr. Peggy Timothy, Dr. Anita Bituni, Dr. Hoda Abdulatif, Dr. Karen Burdett, Dr. Kabani, Dr. Patel, Dr. Moss, and Dr. Kyle Vasey. All right, I think that's it. Oh, okay, well, we do have the Eastman Institute for Oral Health here. Okay, so the program director is Dr. Sangeeta Gajendra. Oh, sorry, please go back. I don't know if is Dr. Sheikh here? No, I don't see his name. All right, okay, so we can move on. Right. Dr. Sangeeta Gajendra is a program director. And would like to acknowledge Dr. Victor Badner as well. Please move on to the next slide. Okay, do we have Dr. Sangeeta here? No, I don't think so. Right, okay, so Dr. Sucharu Ghosh, are you here? Yes, I can see you. All right, would you like to unmute yourself and say a few words?
Yeah, first of all, thank you so much for arranging this event. And Dr. Gajendra really wanted to attend the event, but unfortunately she had clinical care for patients today, so she couldn't attend, but she asked me to apologize to everyone on behalf of her. And I am so great that I chose this program, and I am so happy that I am graduating from this program, and I am looking forward to join this workforce. And as I said in my comment, that I would really love to thank Dr. Gajendra and the whole community department, the administration, the assistants, everyone for being this enormous support throughout the residency program. And thank you so much.
All right, thank you. Okay, so we'll have a screenshot. Okay, moving on to the University of California, San Francisco. This is my program. I'm Dr. Eni Obadan Udo. And I'd like to acknowledge all my residents who I think are all here today. Let's see. Starting with, next slide, please. Dr. Hayam Megali. Hayam, would you like to unmute yourself and say a few words?
Thank you so much, DPH, for organizing this event. And this is really appreciated. And thanks to Dr. Eni for your leadership, your continued support. And I would like also to thank Dr. Pollack for his mentorship. Also, I would like to thank my co-residents for their moral support and what we learned from each other, and like the motivation that we supported each other with. And last but not least, my family, my husband and kids, for their support and patience. Thank you all.
Thank you. All right, next we have Dr. Gabriel Chong.
Hi, well, thank you for organizing this virtual graduation ceremony. I'd like to take the opportunity to thank Dr. Annie, for being our residency director. My research project mentors, Professor Stuart Gansky, Dr. Christine Hoff, and Dr. Christine Kearns, and also the other faculty who have taught me. I also want to thank my wife for her tremendous support and love. And last but not least, God, for his blessings and the opportunity to come to the US to pursue further training in dental public health. After this, I'll be returning to Singapore to continue as the head dental officer of the Singapore Armed Forces, as well as the chairman of the Dental Public Health Dental Specialist Accreditation Committee at the Ministry of Health. And I look forward to working together with all my colleagues in America. Thank you.
All right, thank you, Dr. Chong. Dr. Parmar, Digvijay Singh Parmar.
Hello, everyone. I want to say thank you to everyone for organizing this virtual graduation. and I'm going to graduate from the University of San Francisco for my dental protocol program. I also want to thank you, my program director, Dr. Annie, and my research project mentor, Dr. George Taylor and Dr. Susan, for giving me this wonderful opportunity and learning lessons of my life for the public health career. And thank you so much for everything.
All right, thank you. And last but not least, Dr. Shivari Kirandi.
Hello, everyone. I'm Sharwari, and thank you all for being here and celebrating with us. I would really like to thank my program director, Dr. Annie. She has been a wonderful support, and she has really continued guidance throughout my academic journey at UCSF. Also, I would like to thank my faculty and my research mentors, and also my supervisors at the field site at Alameda County and La Clinica. And I would also like to thank my co-residents and lastly, my husband, who has been really supportive during this academic journey. Thank you, everyone.
All right, thank you. And I think if you all put on your videos, I think Dick Vijay, are you there? We can have a screenshot. Okay, right, fantastic. All right, congratulations. Okay, and I'd like to invite all the residency directors and all the residents, the graduating residents, to turn on their video camera so we can just have one large group screenshot for the program. Okay. Is that Annalise? Okay. All right. Okay, so we can all say DPH.
Sorry, I'm working quickly.
You're working quick. I know. Yeah. All right. Well, congratulations to all the graduates. You have all achieved a major milestone in your professional careers. And so you should all be so proud. We are very proud of you. And we can't wait to see all the big things that you're going to accomplish in your careers. You are the future of the profession. And so really, we're rooting for you. Okay, right. Do we have everyone now? No?
Oh, if I may, Dr. Inder Singh, who I know was stuck in traffic.
Sure.
Would you like to say hi to everyone? You missed your opportunity and it wasn't your fault. So.
Yes, so thank you very much. It's a ceremony for our graduation, but it's also my birthday. So
yes, happy birthday.
The worst place to be stuck is at DMV because my license expires after 10 years and I have to be there. So I got stuck. I thought I'll be done. So thank you for organizing this. And I wanted to thank you, BU, and the amazing faculty that we had. Dr. Tavares and Dr. Hayes as program directors, Dr. Garcia, program chair, but I just cannot thank the faculty for being so caring and amazing. It was a journey filled with COVID challenges and learning remotely, but amazing. My faculty supported not only me, my co-residents, I see that all the time, but the type of work we put in this public health arena, and we should be proud of this field. We are dedicated to not just patients, but the population. So I wanted to thank you everyone from my heart for doing everything for me and what multiple hats everyone wears in this field to keep this field progressing. I am proud of it to be a part of this field. So thank you again.
All right, thank you. And Annalise, do we have what we need for a screenshot?
We do. Thank you all so much.
Thank you all. Do we want to open the floor up to anyone who has a comment? Okay, yes, please, if you want to unmute yourself and just say something to the graduates, congratulations, or any words of wisdom.
Hi there, this is Ioma. I'd just like to say congratulations to my little big sis, Dr. Ekwe Ioma. It's been fun and exhilarating in watching her get to this point in her life. And I'm happy to be part of her journey. and looking forward to much more accomplishments from her.
Thank you.
Cheers, sis.
Thanks, bro.
All right, anybody else?
I also didn't get a chance to thank Dr. Borman, who's also my co-program director, and Dr. Griffin, who's been instrumental in my research projects, and Dr. Hamilton, just the people who are making this process so much less daunting than it could be. So I really want to thank everyone else at CDC who have made the journey during this remote setting of COVID still a learning experience. So thank you.
Yeah. All right, thank you. I'd like to invite Dr. Francis Kim to say a few words.
So I just wanted to say hello, congratulations. As Annalise and Annie had mentioned, it's third time we did this hosting this graduation celebration, and through COVID and whatnot. But it is a great specialty, if I can say that. And I've been proud to be a dental public health specialist, and I look forward to joining you all as into the fold of dental public health and as colleagues. And if you ever have any interest in an idea that is related to dental public health, feel free to reach out. I'm with Annie, I'm sorry, I don't know if people know, I'm the executive director for AAPHD. I know I met a number of the residents during NOHC, and that was wonderful to see all these bright young faces ready to take on the world. So don't hesitate to reach out for anything. So thank you.
All right, thank you, Francis.
May I make one more comment?
Sure.
I see Dr. Collins saying congratulations from a real old timer. He's not saying, he just wrote it here. He said, keep the faith. So I think keep the faith is important as you go out there into the world, because we've made, we've often commented here how we wear many hats, and you may wear a lot of hats before you find one that may stay on for a bit. And even then you may be wearing more than one, but just remember, this is your specialty, and whatever you do, this is your specialty, and, honor it, keep the faith. Thank you, Skip Collins, for saying that. And please come to the AAPHD meetings, stay connected. We're your family, we're your group, we're your reference group. So I'm hoping that we see a lot of you in Orlando, not just for Disney World.
All right, thank you, Dr. Tavares. And I see that Scott Toma put his email in the chat, so if you want to reach out to him as well, please feel free to copy down his email. Any other words from anybody else?
I would ask for words of wisdom for the wonderful people that came before us who are in dental public health, and anything you wish you knew then that you know now.
Who wants to take that?
Can I say something about that?
Sure.
I think it was said before, Mary had mentioned, this is your home. Nadia had said this too. This is your home. Go out and meet people. Just keep on moving forward, connect, network, always reach out to whoever you can. And I really do think we're a really nice bunch of people. I know you're laughing, but I think sometimes I remember being really, really, really nervous about meeting folks. You've read their papers, you've read their work, and it's hard to get over that. But I think we are nice. Everybody wants to help and look for opportunities. And be open to new challenges, and as Megan Coit said, it's a very broad specialty, right? It's one of the ones where we actually expand our knowledge when we graduate from dental school, and it's a constant learning process. But I really do think, you have a lot of resources, and don't hesitate to reach out. If someone doesn't know, they can help you find someone else who might know that answer. So I know, but it's scary, and it can be scary, but just keep on challenging and moving forward. Again, encourage taking the boards, being a specialist. You are I think of you, you are the future. You are the future of the specialty, and we need your voices, and we need you to carry those messages through time, and then train and the next generation of dental public health specialists. So just stay connected, even if you're overseas in probably a 13-hour time difference, we're still here. So don't hesitate to reach out at any time.
Right. Thank you, Dr. Kim. Wise words. We need you. We need your ideas. We need you in the profession. And so do not discount the role that you can play in moving the profession forward. All right. Anybody else? Okay. If there's no one else, I think we can move to wrap this up. Thank you all for attending. Congratulations once again to the residents. Congratulations to the program directors. And thank you to all our sponsors and co-hosts, AIDPH, ABDPH, AAPHD. And I'd like to especially thank the people who have worked behind the scenes to make this possible. Dr. Annalise Cotran, Dr. David Capelli, Miss Anna, Miss Kiara, Dr. Francis Kim, Dr. Gina Thornton-Everans, and everyone else who contributed to the success of this event. Congratulations, and look forward to seeing you all at the NOET next year. Thank you and bye.